America is struggling with racial inequality and health disparities in this pandemic. So this morning, we're looking at the importance of diversity in the medicine field through the eyes of an African-American neurosurgeon in training. We met him before COVID-19 gripped the nation. Only about 5% of U.S. doctors are black. That's 1 out of every 20. As Adriana Diaz shows us, that lack of diversity can affect patient care. Adriana, good morning.
Good morning. Not only are black doctors such a small percentage of physicians, black men are especially underrepresented. Listen to this. Medical school attendance for black men actually dropped 39% since the mid-'80s. So the doctor that we met here, Dr. Aaron Palmer, he's a minority within a minority. His is just one man's story, and it's a story of resilience. Before the sun even touches the Chicago horizon, Dr. Aaron Palmer is rising to meet his day.
I usually wake up between 4:15, 4:30.
At Northwestern Memorial Hospital, he's training in neurosurgery, one of only 2 black neurosurgeons out of dozens in his department. Nationwide, only 1.3% are black.
I often get confused with housekeeping, transport, you name it. I often have to, no, I'm, your doctor taking care of you.
Really?
Yeah. There aren't a lot of people of color that are physicians, especially black men. I think that is something that needs to change.
Dr. Babak Jerome, who trains Dr. Palmer, says he sees the benefit of diversity every day.
Working with Aaron is a joy because he knows where our patients are coming from, and our patients trust our team more.
Black patients are 37% less likely than white patients to say they trust their doctors. One reason, the Tuskegee syphilis study. From 1932 to 1972, the government experiment deliberately left black men with syphilis untreated. Many died. Research shows that black patients receive poorer care, even less pain meds, than white patients. But preventive care improves when black patients see black doctors.
Motivation is not enough.
It's Dr. William McDade's job to help more minorities make it in medicine as the head of diversity for the national committee that oversees medical training.
There are economic disadvantages that have to be overcome. There are educational deficits that have to be overcome. And there's structural racism that exists within society that actually carries into medicine as well.
He says children of color also need to see doctors who look like them, something Dr. Palmer and his brother Tim did not have back in Akron, Ohio.
Where we grew up at, no one's a doctor, no one's a lawyer, no one's a judge.
Their parents raised 5 kids in a 2-bedroom house.
This is the home that we grew up in. It's all torn down now.
As his mother Amy recalls.
I had to teach my kids not to pick up syringes when they saw them on the sidewalk, and that is not an exaggeration.
But like many low-income kids of color, he lacked resources and mentorship. Until his college professor, Ann Capilea, gave him textbooks and confidence.
Dr. Palmer!
We arranged a reunion more than a decade after a pivotal meeting.
That's the first time I've called you that.
I was probably expecting her to say, it's not something that's going to happen for you. But she said, and I'll never forget this, she said, of course, I think you can do it.
How important is it to hear someone say you can do it?
That moment is the reason why I'm actually standing here.
With her support, he got into medical school. But 4 years later, no residency program accepted him. You have a medical degree.
Correct.
Without anywhere to go.
Correct.
Dr. McDade says medical students of color often struggle with isolation, imposter syndrome, and standardized testing, and are more likely than whites to not get into residency or not complete residency training. But Dr. Palmer tried again, and Northwestern said yes.
You look great. My name's Aaron Palmer. I used to live in that blue house over there.
Oh, okay, I remember your dad.
I'm down in Chicago now.
You're a surgeon?
Yeah, I operate on the brain and spine.
What would your 10-year-old self think of someone like you?
Poor little 10-year-old Aaron his mind would be blown.
Now he's the role model his neighborhood never had.
It's a pleasure. Thank you.
And Dr. Palmer is paying it forward. He mentors younger students and is researching racial disparities. But make no mistake, the state of diversity in medicine is dire. The percentage of Black and Latinx doctors has hardly budged in the last 15 years. Vlad?
A mentor is someone who helps you find the hope within yourself. Adriana, thank you so much. What a wonderful story.